A pressure ulcer is basically a bed sore, and it's a breakdown in skin that is caused from pressure or rubbing up against the skin. Bony prominences on our body are most at risk, such as our elbows, knees, heels, as well as the buttocks area.
Interestingly, people don't often think of device-related pressure ulcers, and those can happen over bony prominences too, over the ears from a nasal oxygen cannula, a nasal cannula, the tubing.
We are at risk for not being reimbursed for care through CMS if a patient does receive a pressure ulcer while they are in our facility.
Looking at our strategic plan and really keeping patient experience front and center, we looked at things that we knew that we needed to improve on, and hospital-acquired pressure ulcers was one of those things.
So the clinical nurse educators as well as the wound care nurse came together and developed a pressure ulcer prevention education packet for our staff on the units, and then that was rolled out all throughout the summer of 2013, and then at the end of 2013 we actually initiated an orientation opportunity for new hires in which they spend 8 hours of their orientation with the wound care nurse, actually rounding with her to get a greater appreciation of interventions that can be applied to our patients to help prevent pressure ulcers.
Nursing staff had an orientation with our wound care nurse, and that began in December of 2013. So we really gave the bedside care providers increased knowledge and a different skill set relative to wound care. The second component of dealing with this program was to really deploy the Tally Up Tuesday in a different manner.
Tally Up Tuesday is not new to the system. It is a snapshot in time, a day in the week, where anybody with a pre-existing wound it's measured and documented in a very detailed manner. Here, Tally Up Tuesday is maybe taken to just one more step, and it involves Maria, our wound care nurse, is very involved in making sure that tally up is done on every unit.
This is Maria. How are you?
So anybody that falls in a risk category, risk score, we make sure that every preventative measure is in place on those patients. We've built that into the Tally Up program.
There are actually many measures that we utilize to prevent pressure ulcers, such as air mattresses, skin barriers to prevent breakdown from incontinent care, as well as consulting nutritional services and the wound care nurse, and then rotating and turning our patients every 2 hours and providing them with cushions or pillows for their limbs so that they're not dangling or rubbing up against the sheets.
Our TBI unit is up to 57 weeks this week, and it's based every Tally Up Tuesday, so that's how we report that out. They're at 57 weeks with no pressure ulcers. Our medical unit went 54 weeks with no pressure ulcers. You won't often hear from a patient about safety because they come here and expect to be cared for safely. That's an expectation of care, period. When you involve everybody, that's where the success comes. When you talk about it and you measure and you report and then you re-look at your data and fix what needs to be fixed and reinforce teaching, the program becomes seamless. That's the nice thing, is it's seamless now. It's just what we do.
So everybody pulling together to deliver on behalf of the patient is really what Oakwood Hospital Taylor is about.